Hello, this is Will the Dreamer coming to you for the 10th episode of the podcast. And it's a 10th episode commemoration. With great pleasure, I'm going to bring you Dr. Tim Talbert. He's an institution by himself. He worked as a local cardiologist for the last 57 years and retired at the age of 88. That's virtually unheard of with so many changes in medicine and in healthcare system. So first of all, let me give you the background when he grew up and where he got his education. A second part will be his career as a cardiologist. And a third part, I'll mention how he's flexible and adjusts to the economic change and change in technology, and ended up with something that he has special concern about cardiology. So let's get started. Dr. Talbert is a resident of Canada. That's a small town in southeast Missouri area. He got his education from University of Mizzou, that's in the 50s, and he finished college in 3 years and went to the prestigious University of Washington Medical School. And he finished and did internship and residency at Jewish Hospital in St. Louis. That's 2 years at that time, and he finished with 1 year of cardiology fellowship at University of Mizzou. At that time, a standard. After that, he went to serve in 2 years of public health service. He did research. He was sent to South Carolina. At that time, he found out that there's a lot of hypertension in the Afro-American population. And they find out that most likely the reason because of lack of refrigeration. Remember, in the late 50s, early 60s, refrigeration is not commonplace. And with some of the Afro-American population with lesser means, they use nitrates and a lot of other preservatives. That bring the sodium level rather high. And they find out that that's most likely the reason in correlation with hypertension. Somehow, it took quite a few more years, multiple other studies, before they confirmed that. Dr. Talbert started with the initial studies in his 2 years in South Carolina. Now, the second part is that Dr. Talbert then came to Southeast Missouri, Cape Girardeau area for the cardiology practice. There are 2 hospitals. He joined Southeast Hospital and St. Francis Medical Center. There are 3 doctors. They form a multi-specialty group, and later on add on oncology and others. And internal medicine. And Dr. Talbert take referral practice only for cardiology. His practice grew very fast, and he had a very big practice. Now, in the 70s, that's beginning of open heart surgery and some cardiac catheterization. That means putting a catheter into the blood vessel, and you can go close to the blood vessels of the heart and send some dye in and see blockage. So you can know exactly where it is blocking at the blood vessels supplying the heart. That is a very important development because in the old days, you only use stress exercise test to see the change in EKG to see if there is a lack of blood supplies for the heart. But now you can exactly pinpoint where and what and the degree of blockage. And with that pioneering and with further development, that's angioplasty. Now, Dr. Talbert started doing a lot of cardiac catheterization, but in the 1980s, there's further development that not only you can put a catheter in, you can blow up a little balloon at the tip of the catheter to unblock it and flatten up the plaque that's blocking the blood vessel. That's major development. In this area, Kansas City, St. Louis took the lead, and it spread to St. Louis, and Dr. Talbert and other cardiologists quickly picked this up and offered the service at Southeast Missouri area. Now with that, with much better diagnosis, that's a possibility that some are more appropriate for open heart surgery, others you can do angioplasty. So Dr. Talbert was instrumental in helping recruitment and starting the cardiothoracic surgery at Southeast Hospital with 2 cardiothoracic surgeons. St. Francis Medical Center followed within 6 months. So that brings a lot of advancement and help in the Southeast Missouri area. And Dr. Talbert himself went out on his own, will become single specialty cardiologist, recruit some people, finally end up with 4 cardiologists, the 4-man group that he can work very well with. And that was stable over 8 years, great practice, and gradually they add on more and more members. Now, even with angioplasty, with the balloon clearing up some of the plaque, they come back 40% of the time. So that's by no means perfect. But in 1995, around that area, there's another development called stenting. Not only you open up the plaque, unblock it, you can put a little plastic catheter inside that blood vessel to allow blood flow to go through. And that reduces the reblocking rate or restenozing rate way down below 40%, way down. So it becomes very effective and help the patients out a lot. At that time, the cardiology group grew to 8 and then to 10 people. In the 2000s, the hospital split up and brought a lot of primary care physicians. Half of the cardiology group, maybe 5 members, went to St. Francis, including Dr. Talbert, and 5 of them went to Southeast Hospital. Now, about 2010 time, Dr. Talbert transitioned from private practice, owning a cardiology group with his members, to become a hospital employee again. But he adapted very well and flourished in that environment. And not until the age of 88, that's about 2 years ago, that he retired. Now, I want to end the note by mentioning the changes throughout. So there's financial change from joining a group of multi-specialty group to individual practice and forming his own group, and then joining the hospital again, become an employee. Dr. Talbert adapted so well that with the economic and political changes. More than that, electronic medical record become a thing in the mid-2000 time, and there's several versions of electronic medical records. A lot of physicians in their 60s and 70s simply don't want to deal with the electronic medical record, which is very different from conventional writing your own progress note or typing them up. A lot of people quit or retire early. Dr. Talbert underwent at least no less than 3 versions of different electronic medical records and flourished. Also, every year, Dr. Talbert went to the American College of Cardiology conferences and hands-on version that sometimes they spend a couple of days bringing the new technology in cardiac catheterization, angioplasty, stent placement, and various other workshops. And he kept up with that and bring it back to the Southeast Missouri area. So not only in the change in technology, both in medical records and in cardiac technology. Now, at the end, Dr. Talbert tell me 2 things that still stands with him at this time, even after he retired. He said that, look, there are some people at an early age have heart attack and heart disease, blockage of the heart, and somehow their relatives, their kids, at the age of 30 or 40, have an early heart attack. Now, we are very good in doing genetics, finding out breast cancer gene, colon cancer gene, who is at risk. But so far, according to Dr. Talbert, that's really not a lot of study and progress in that area. Another major change that helped out the heart patients a lot is the anti-cholesterol medication. Remember, the blockage, they are mainly made of cholesterol and calcium. So we have anti-cholesterol medication reduces the cholesterol buildup. But what happened to the calcium? So far, there's really no direct address or medication to tackle the problem of the calcium buildup. So not only Dr. Talbert is passionate in his practice, flexible, undergoing so many changes, his mind is still thinking about cardiology and leave some of the unanswered question. Hopefully, we can have better answers down the road. So it's with great pleasure I'm closing the story on a remarkable career in an institution by himself, Dr. Talbert. I hope you enjoy it and can borrow from his example, be flexible and make changes and have a long career if you want to stay with such career and build it with passion. So dreamers, don't forget to subscribe. When you like this episode, subscribe below and keep on dreaming until we meet again. Bye.